Hello, everyone. Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early relief. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So today we have with us renowned dermatologist Dr. Mamtha S Kusagur, who is a practicing dermatologist and cosmetologist in Kusagur Hospital since 10 years. She completed her MBBS and MD in dermatology and cosmetology degree from JJM Medical College, Davangere. She is trained in dermatosurgeries from the Victoria Hospital, BMCRI, Bangalore. Her special areas of interest include acne, pigmentation, scar treatment. She has published her research works in national and international conferences. She also has many publications to her credit. A very warm welcome to you, Dr. Mamtha S Kusagur, and it's such a pleasure to have you with us, Dr. Kusagur.
Thank you. Thank you so much,
So,
Samyukta.
doctor, today we are going to talk about urticaria and why it's so important to talk about it. Because, as I have already mentioned in the introduction, that it's quite common. But then people are not. I mean, many a times they are confused that is it just because of the food allergy or the food having or what it is. And as we said, one-fifth of the population do encounter this urticaria at one point of their lives. So it's quite common. So it's important to spread awareness on this very topic. So to start with, doctor, what is urticaria?
Actually, Samyukta, urticaria is a very common dermatological complaint suffered by many of the individuals in any age group. So, to define urticaria, it's an hypersensitivity reaction. That is, it's an exacerbated reaction of the body to any of the allergen. What you have studied is below the sky and above the earth, anything can be allergic to an individual. So we usually define urticaria as it's an acute or sometimes delayed hypersensitivity reaction of a person due to the exacerbated reaction of his immunity towards the allergen. It can affect any of the age groups and any of the gender.
Right. And how does it look like, doctor?
Actually, the classical or the characteristic lesion in urticaria, what the scientific description is, they are called hives or weaves. They're nothing but transient erythematous, that is reddish looking edematous lesions present over the skin, and they are transient. Usually they disappear within 24 hours of time. Then only it's called urticaria, sudden in onset.
Right. And what causes these urticaria, doctor?
That's what any thing can be allergic to a person, which is normal to another person. So in such case, we usually define 6 I's: any ingestants, any inhalants, any injections, any type of iatrogenic, sometimes drug-induced, or any food that is ingestants, many and any contactants like plants, any chemicals, and any like insects. So all these are like capable of giving rise to urticaria. Infestations, insects, inhalants. So all this can cause urticaria.
Right. So urticaria is quite common, and as you said, many things can, lead to urticaria. Doctor, we know there are two broader classifications, acute and
Yeah,
chronic.
acute.
So what
Yeah.
are these?
So acute urticaria is defined as like symptoms of urticaria which are within the duration of 6 weeks. Okay, if it is more than 6 weeks, then we define it as chronic urticaria.
And doctor, a very common question that people normally ask who are the patients of urticaria that, how long is it going to take to cure? I mean, is it a curable, completely treatable thing?
No, it's very difficult to convey the patients that it's not completely curable, but it is treatable. Sometimes, for that time being, it can be completely curable, but we can't predict regarding the recurrence of the condition.
Right. And what treatment options are there, doctor?
Treatment options to start with, usually the prime treatment is mainly by antihistaminics. There are very too many classes of antihistaminics that I'll discuss later. And then we have topical soothing agents like calamine lotions, pramoxine, many things are there like simple moisturizing lotions and all those things. And apart from antihistaminics, depending on the severity, we have short and supervised course of systemic corticosteroids. And also we have anti itch agents like oral levocetirizine, cetirizine, sedating and non-sedating. All those things we do give. These are the main way of treatment. And depending on the severity, we do treat the condition. Cotton.
Now, doctor, one thing is there that, what happens because we all know that hives or urticaria happens when there is some allergy. So what they do, they'll go to any over-the-counter chemist shop, they'll get an anti-allergen because people are so informed these days, and they'll start having those anti-allergens, and of course they'll get some relief. So they see that, okay, fine, I'm okay. Many times these pills, the anti-allergens are, they have these sedative factors as well, effect as well, which is not very healthy or, advisable if you have some kind of your job nature, which can put you in risk. So we normally do not prescribe them without the proper advice of a doctor, but then this is a very common practice. We'll go over the counter, get an anti-allergen and treat ourselves. Is it okay to do practice, or you suggest that one should first go and consult a doctor, a qualified dermatologist?
Yeah, always for any health indication, they have to consult a health attendant or health concerned doctor, qualified doctor. But sometimes, under fake confidence or false confidence, they do meet chemists. Many of our dermatology patients first they visit chemist shop, then only they come to a doctor. That's a very common thing seen in our neighborhood. It's not suggestible or advisable to take any drug for urticaria without the guidance or advice of a doctor. Usually, they come after taking some cetirizine on and off and all. Sometimes, what happens, the immune system will get addicted to the antihistaminics. So, when they go on taking these antihistaminics in a continuous duration, so that it might affect the other parts of the body also, like kidneys and all.
Right.
So always it's advisable, it should be taken or it should be under the supervision of a dermatologist.
Right. So the bottom line is, viewers, that you need to go and consult a doctor, a qualified dermatologist in this case, to get the right prescription and to know, why it's happening, to get a diagnosis, etc. Doctor, one of my question, I would also like to understand that if we leave it untreated, right? What are the complications? What could be the future complications if it is left untreated?
Definitely, depending on the severity. Sometimes it's in a very mild form and all. So the patient is like irritable, and though they don't have much of systemic implications, the patient will be irritable, and that might make him for job absenteeism and it can disturb his daily routine. If it is severe form, then the emergency steps they come into picture, especially if they have angioedema, that is the edema of the mucosal areas like mouth, tongue, buccal mucosa, and especially conjunctiva, eye mucosa, and sometimes genitalia. And also, this edema can extend to the air tracts, that is respiratory tracts. Then there'll be real choking to the patient, and it can be sometimes impending death consequence also. So, in severe conditions, urticaria should be treated in a very a faster manner as an
Right.
emergency case.
And as we all know, doctor, that it do affects our, quality of life. So I would like to ask you, does stress increase or exacerbate urticaria?
Yeah, sometimes in few conditions, stress can be one of the precipitating factors, especially in a predisposed individuals. Those are family history of allergies or urticaria, or any family history of autoimmune disorders like hypothyroidism and all. So urticaria also comes under autoimmune disease. So in such cases, stress is always one of the factors to induce urticaria in certain individuals. Definitely.
And doctor, one more thing that people normally ask is that how long will the treatment go? Especially in case of acute, I'm sure they'll have it, some immediate effect. But in case of chronic, does the treatment takes like forever, ever and ever?
No, no, not at all. Usually in my practice, what I convince them is it's a minimum of like 3 months to 6 months. See, there are a lot many medicines actually. Usually, but at the end of 3 to 6 months, majority of the patients do respond, especially through a lot many antihistaminics, and also we have like immunoglobulins for histamines, like certain injections. So majority of the patients do respond in a span of 6 months, but we can't give an assurance that it is permanently cured. Again, after 1 year or 2 to 3 years, they might have recurrence. In such situations, we have to treat the patients again. But the duration will be lesser in the future episodes.
Yes. And doctor, what is the importance of diet? Many a times, what people do, they know that there is a blanket list, like their eggs are there, or cheese is there, nuts are there, which
Yeah.
is quite troublesome, troublesome in the sense that it can cause allergy, not to everyone, but then they'll just form a blanket list and they'll say, even if I'm not suffering from urticaria, I don't have urticaria, but at least I can just avoid these things. So, what's your advice to that? Are there dietary precautions or do's and don'ts for patients of urticaria? And is it only for the patients of urticaria, or is it
Yeah,
for
yeah. No, no. It's
everyone?
only for the patients who are like probable candidates for urticaria. We do have certain
Yes.
medicine, like food to be avoided. They're called like pseudoallergens. Sometimes they can be implicated as an inducer of urticaria, or sometimes need not be. But in that phase of acute phase of urticaria, definitely the avoidance of such foods can reduce the severity of the urticaria. Foods like, especially which are high in proteins, especially what you said, like egg, fish, and all types of dry fruits, like dates, like walnuts, cashew, and all, because they have that molecular weight of antigen, and the protein antigen will be higher, and definitely they'll be treated as like important antigen to the body, and there'll be exacerbation of the symptoms. So we usually ask them to avoid such things, high protein diet, and also certain vegetables. It depends on the local experience of the patients. In certain areas, they avoid these green chilies, brinjal, potatoes, pumpkin, and all. And depending on the regions, depending on the state, whatever there is, there's staple food, they usually suggest such things. Sometimes it causes psychological relief for to the patients. As a doctor, as a dermatologist, I ask them to avoid high protein diet at least for 3 months of duration during the treatment. Then I ask them to slowly introduce these foods in their diet.
Right. So that's the thing. And many times we have seen that, especially after, for example, I had some infection, a bacterial infection, a viral infection, or a fever, especially in kids, we see hives on their body. So is it okay, or how dangerous it could be for a kid, a toddler, or, those who are not grown-ups?
Many a times, especially in toddlers or like school-going age group kids, they do have always they tend to have this high post-fever episode. That's a very common thing. The history given by the patients or the informants, whenever he has cold and cough, the patient will be followed by hives and pains. So we can explain them. So especially the upper RTI, upper respiratory tract infections, or any acute gastroenteritis like acute G and all, they tend to have these wheals in that episode. So in such cases, we have to educate the patients and the parents regarding the nature of the wheals. Usually they subside with proper treatment, and our course of antihistamines are more than enough. But we should the patient should be made aware and the parent should be made aware, especially the kids suffering with upper RTIs. They are prone for these hives and this thing, wheals, urticaria.
Right. And doctor, I would also like to understand, what happens many a times patients of urticaria, they'll complain that during night their urticaria become worse or they become very, restless. What is the correlationship?
Actually, during the night after 6 or 7 p.m., there'll be dip in the atmospheric temperature. So what happens then? The body gets adjusted depending on the temperature variation through vasoconstriction or vasodilatation. So definitely there'll be a difference in the peripheral circulation of the blood. So there'll be increase in the release of the histaminics. Not majority, patients whose urticaria is related with temperature of the environment, they get diurnal variations, especially more during the night hours, but not in all the cases. Sometimes they'll have vasomotor urticaria where the exacerbation or increase in the symptoms will be more during 4 a.m. to 6 a.m. So that also is there. Especially when there is dip in the atmospheric temperature by 1 or 2 degrees, they'll have that difference in the symptoms.
Right. And doctor, there are again a lot of them, who complain of getting very fatigued or tired very easily. So is this because of the itching that's involved or the medication, etc.?
No, it's because of the physiological changes with hemodynamics. What happens during an attack of urticaria? There'll be peripheral vasodilatation because of the increase in the release of histamine. So, especially when there is pooling of blood towards the peripheral circulation, definitely the other organs get relatively deprived from blood circulation. So that makes them tired, especially if they are deprived of this glucose supply at the level of cells. They feel that tiresome and all. They have that feverish symptoms, like the skin becomes warmer because of the increased blood supply because of vasodilatation. Definitely, they have the tiresome symptoms will be there.
Yeah. So that's the thing. And many times we have seen that, especially after, for example, I had some infection, a bacterial infection, a viral infection, or a fever, especially in kids, we see hives on their body. So is it okay, or how dangerous it could be for a kid, a toddler, or, those who are not grown-ups? Was it the same logic, or there were some other factors responsible as well?
See, along with the infection, sometimes there can be drugs also inducing the hives in the patient. So we should be in a position to differentiate whether it's because of the infection or because of the child's nature or the individual's nature for going in for allergic manifestations. Sometimes medicines given for the treatment of infections, so infections are also causing. So we should be differentiating whether it's drug induced or the infection induced. So that we have to convince the parents.
Okay. We have one viewer with us, Tina Bhargav. Her question is, I have brown patches from past 2 years. What should I do? Do these brown patches mean urticaria? Because urticaria, as you said, is like bumpy, itchy.
No. Especially articular patches are transient. So first information what should we get is whether they are transient, whether they completely subside or they are persistent. That is main differentiating point. And it should be with severe itching. And they should be edematous. That is, they should be elevated above the skin level. Simple patches which are persistent and which are itchy, they come under a lot of differential diagnosis. For that, we have to further evaluate the patient.
Fair enough. Doctor, when a patient comes to you and complains about, his lesions, maybe the patient is not aware whether these are urticaria or some other allergy or infection, etc. Are there any tests to diagnose, or you just by the clinical examination or physical examination can tell that yes, this is urticaria? Do you do any kind of test for that?
Yeah, definitely. One is it's a clinically diagnostic condition, urticaria, depending on the history and the clinical examination. Next is like to differentiate what might be the reason, whether the patient is really predisposed for this condition. So we do get done the eosinophilic count, general and absolute eosinophilic count, and complete hemogram to know the sometimes anemic status and sometimes neutrophilia if they are like having continuous infections and lymphocytes this thing percentage and all. Definitely complete hemogram is very important and absolute eosinophilic count. And also sometimes if they have worm infestations and any other infections, there'll be increase in the eosinophils. So we have to treat accordingly. And second is we try to rule out if they have that autoimmune profile within them or within the family members, then we do get a thyroid function test. And especially in severe conditions, we still upgrade the diagnostic test to know the levels of serum Ig, that is serum immunoglobulin E levels. In a few of the patients, especially below 5 years of age, they tend to have higher serum immunoglobulin E levels. So in such conditions, the treatment might prolong for a longer duration. And the other things like if they are like continuously, we call it as a chronic urticaria, especially in chronic idiopathic urticaria, almost all the hemogram values will be normal. But especially if they tend to find some allergens, we do get done allergic skin prick test, allergic in vitro and in vivo skin tests are there. In that thing, we do get very reliable results with what the patient might be allergic to. So we can during counseling and all, we usually ask them to avoid such allergens.
Right. We have one more viewer with us, Ria, and her question is that what are the long-term management options for urticaria?
Oh, so usually, as I told in the beginning, like usually the treatment might last from 3 months to 6 months. So usually we try to give different type of antihistaminics depending on the age, gender, and their work pattern. So after giving a series of antihistaminics on different intervals, then comes the injection immunoglobulins for histamine, which is usually they follow different regimens, but I do follow weekly once regimen for 6 to 8 weeks. Then once the patient starts showing improvement, then I'll switch over to fortnightly injections and once in 3 months, not less than 12 to 14 injections, subcutaneous injections. Usually, this is a very common thing followed in chronic urticaria.
Okay. Doctor, at home, can we, make or follow some diary where we can jot down, after maybe what all I did throughout the day
Yeah.
when I got these lesions or hives. So, is there a way we can do something to figure out a pattern or something?
Yeah, definitely. It's one of the a management method also where we ask the patient to make a book or a note in a small diary. Whenever they have that exacerbation, we ask them to take for 2 or 3 days past history, their daily routine, where all they have visited different places, and also what are the foods they have taken and fluids, like drinks, what all they have taken, and including the perfumes, including the clothings, fabrics, everything is included in this note, especially the ingestions, food and medicines, and the any area they have gone. So definitely, it's of really great help.
Many times people are confused when they have these, anything related to their skin, anything on their skin, whether it's an infection or hives or, these raised bumps. They'll try to find out what it is. Is it some kind of infection or some kind of allergy? Can we, put it into urticaria? Because as a layman, many a times we don't understand whether it's urticaria or not. Are there any, characteristics, though you have already explained the characteristics of urticarial lesions, but still, for a layman to understand, for example, if I have these, ant bite kind of lesions, can can I say that, yeah, this could be urticaria? I need to go and immediately talk to a doctor. So, what are the things that we as laymen need to, understand?
First is they should know the symptoms which they should be bothered for, especially if the condition is sudden. Okay, sudden, they'll have reddish rashes, what you said, like elevated wheals. And also, if there's a concept called dermographism, where we can, so dermographism is graph on the skin is called dermographism. That is, whenever they scratch with fingernails, they tend to have the patterns of these nails. Okay, though it is common in 5% of population, if these pattern is persistent, like for more than 2 hours, 3 hours, then we can categorize the individuals as having urticaria. And also, we should educate the patient that if the lesions are sudden and if they're too much itchy and if there's swelling of lips or edema around the eyes, and especially itching over the extremities, palms and soles, and they all come under urticarial symptoms for which they should be concerned about.
Right. So the most important thing is to understand that in case anything happens on your skin or in anything which is not normal, you need to go and consult the right person rather than going for over the counter medication or self medication or asking a friend or family. Many a times it happens, doctor, that because there are people who are always willing to help us, and they'll say that, oh, I also had urticaria and here's the prescription that doctor advised me. You can take this prescription and follow the whole treatment, you'll get the relief.
Yes.
And people do that, they go for it.
Yeah.
So how dangerous it would be?
Yeah, definitely. In patients with coexisting or comorbidities, especially if they are cardiac patients or if they are nephrologic, that kidney patients and all, definitely there are many drug interactions with the antihistaminics like loratadine, tarfenidine, and all cetirizine sometimes. So they should be cautious, especially the senior age group and who are having comorbidities. It's not. It's very objectionable to going for OTC medicines or like self medication. It's very wrong. Only thing these youngsters and all, they tend to take this cetirizine and other things and come to us, though not of much relief. For timing, it will be okay, but it's very wrong thing to go for self medication.
Right. We have a viewer with us, Suhana. Her question is, could my current medications or supplements be contributing to my hives, and should I discontinue them?
Yeah, definitely. There's a big list of medicines which can induce urticaria depending on the individuals and their immunity. Especially the antibiotics, they are known antibiotics and analgesics. They are very much known drugs which can induce urticaria, and sometimes supplements. The iron supplements do have that nature of causing urticaria. It may even we have some health drinks, high protein milkshake, I mean, like health this thing, drinks and all. They tend to induce urticaria.
Doctor, can it happen that, till now I'm not allergic to anything, or I have never had these urticarial rashes or lesions, and suddenly I develop an allergy towards, say, anything, to a particular medicine which I had taken before as well. That time it was sober to me, but now it's showing signs, or to any food items, etc. Is it possible that one, you can be, non-allergic to a certain stuff at one time and get allergic to it at the other?
Yeah, yeah. So we have lot many examples like that. Sometimes a same medicine taken prior few days prior must have not caused any urticaria, but this time it must have like induced an episode of urticaria. Definitely, chances are there. Chances are there.
Right. Does family history matters if my parent or were allergic to something, or they had this history of urticaria? Is there a risk factor or a chance for me to get it as well?
Yeah, yeah, definitely. Family history is of very significance. Majority of the patients who has urticaria has a family history of atopy in the form of urticaria or asthma or allergic rhinitis. Definitely, family history is very of major importance.
So, do you think that we can do or take some preventive measure in case there is a family history of urticaria? Can we do anything about it?
Precautions we can take, but we can't prevent them from getting urticaria. Only thing is we can ask them to avoid high protein diets, and especially going in for dust or any like areas which are prone for like insect bites and all, and especially medicines. They should be quite aware. The drug sensitivity runs in families actually, so they should be cautious.
For example, we know what is the trigger factor. For instance, maybe nut is contributing to urticaria in me. Do I need to avoid nuts forever? I mean, I can never touch a nut in my life, or I can start it again, or what's the procedure like?
Yeah. Sometimes if we get to know what the food causing urticaria or the environment causing urticaria, then we are usually when the patient is under treatment, we ask them to avoid such things for 3 to 6 months. Okay, the sensitivity of the body to an allergen will be there for something around like 3 to 3 months, especially 3 months until that T cells population in the body gets reduced. So we usually ask them to avoid for 3 to 6 months, but in future they can go in for like intake of these medicines, but under a minimal this thing quantity and with a longer gap, not like very much like a binge eating or like with a more frequent intake. We have to we can take in small quantities in a distant intervals.
Fair enough. We have one more viewer with us, Tina. Her question is: are there any self-care strategies I should follow to minimize the impact of urticaria on my daily life?
Yeah, definitely. Especially these individuals who have more of dry skin. What I've seen in my practice is they tend to develop more wheals. Especially it may be because of the outer allergens like dust or insects or some fabrics, textile allergy and all. So even they tend to have wheals. In such cases, we can ask them to avoid the episodes of urticaria or allergy, and also the severity could be reduced by using more of emollients as a part of their body skincare, and also to drink lots of water. So water is a very good detoxifier which can dilute these allergens in the body, antigens and allergens. So intake of more water, 2 to 3 liters every day, and keeping your skin hydrated and moisturized by using body moisturizers.
Right. We have one more viewer with us, Purvi. Her question is it safe to continue exercising or participating in physical activities if I have hives?
It's a dilemmatic question because your patients tend to develop hives post exercise or post working out. So, in such individuals, we ask them to avoid going in for such activities, which is called cholinergic urticaria. They have the symptom of papules or wheals immediately when they go in for a brisk walk or do yoga or like sweat out. In such individuals, we ask them to avoid such things. We ask them to like follow some other way of burning out the calories, and especially these workups should be reduced during the episodes of wheals and hives.
Right. So you should avoid exercising or stuffs like that to when you are undergoing the treatment, right?
Yeah.
Okay. And doctor, is it contagious?
No, not at all. It's not contagious.
Right. Now, what happens? Urticaria leads to bad quality, or it deteriorates your quality of life. You're continuously itching, and many a times you start avoiding, going in public, attending social events, etc. And thus, it goes beyond just a skin allergy or something like that. It affects your mind, your psyche, your well-being, mental well-being as well. So, or does counseling also part of your treatment?
Yeah, definitely. Urticaria, the counseling forms 50% of your treatment in urticaria patients, especially if they have that social embarrassment and social withdrawal, and also sometimes job absenteeism. All those things really affect the psychology of a patient. They lose their confidence sometimes, especially in student life and in a working individual. really counseling matters a lot in treatment of urticaria.
Right. So counseling does matter a lot. And even as a family member, I think it's important to understand what urticaria is in case, any of our family member or friend or colleague is, suffering from it. Let's not make mockery of them or irritate them further. Let's do something to create a, relieving atmosphere for them. And that would be really good for us to get them introduced to a qualified and good dermat who can help them treat them. We have one more viewer with us, Sonam, and her question is, if I suspect an allergy is causing my hives, should I consider allergy testing? Again, allergy tests are in, trend these days. So do they work?
Yeah, definitely. Majority of the allergic tests give good results, and an avoidance of these allergens really improves their life. If not all allergens, definitely few of the things on avoidance can reduce urticarial episodes.
Mhm. Now, what we see these days are that rather than going to a dermat and ask for what test are they suggesting or not, people are going themselves to the labs and getting these patch tests etc. done, and then with the reports they'll go to the doctor and say that, see, I'm allergic to 30 food items, and of course omitting 30 food items from their plate is not a very good idea or very wise idea. So, what's your take on that? Do we need to consult a doctor before going for these tests, or we can just surpass the doctor and go to the lab ourselves?
Yeah, now the field of medicine has become a big field of business. There are a lot of laboratories give ads of master checkup, master laboratory checkup, and all. Nowadays, they are including allergic profile also as part of these this thing list of diagnostic tests. It's not a welcome sign to going for allergic, because one or the other things, especially in an allergic profile, they try to around they check in for some 40 to 400 to 450 type of allergens. One or the other thing can be allergic to an individual, so they definitely 10 or 15 allergens will be positive with the individual. So but they need not give to a to such a level of allergy. They can have that articular episodes. Sometimes it is like taken care of the body itself. So they might become panic also listening to that if they are allergic to very simple kind of food intake and all. So it's not suggestible to go all of a sudden to go in for such a important test of allergic profile. Not a good sign. But because of over awareness through social media and all, nowadays individuals do come with a list of allergens to which it has come positive, but they don't have any symptoms. That is a very ridiculous part of that. It's not advisable unless they have symptoms. Then only they should go for allergic profiles. They give
Exactly. So
discount
please
a
consult your
sale. It's
doctor
like a
first,
discount
and
sale.
then
Yeah,
suggest.
for one test they give
You.
other
And
tests
doctor,
as
before we
free.
wind up the whole session, any take-home message for our viewers?
Definitely, urticaria is a medical condition which requires an important consultation with a qualified dermatologist. And though it's a treatable condition, it's not curable. So you have to be aware of the allergens to which you are allergic to, and try to follow up with a good clinician.
Right. Thank you so very much, Dr. Mamtha. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you so very much.
Thank you so much, Samyukta. Thank you.
So, viewers, now at least you know what is urticaria, what are the causes. There are n number of causes, of course, but now you know, which is the most important part, is to rather than going for self-medication, over-the-counter medication, asking a friend or family, etc., please go to the right person, which is a qualified dermat. Thank you so very much, all of you, for joining us. Have a good day ahead. Goodbye.
Thank you. Thank you so much.